Hi, I'm Rick Tabor. So I'm the Generations Magazine Community Development Director. I'm also with Caregiver Council. I'm Vice President with them. Hawaii Meals on Wheels, I'm their secretary, and I also am an ambassador with the Alzheimer's Association. And then I'm very active in the Rotary with the Kapuna Kakua committee, and I'm the chair of that. I mention all of that because today what we're going to talk about is when and how to get a caregiver. So for several years I was an operations manager with a local in-home care service doing in-home assistance. So when to get a caregiver? So here's 8 signs telling you it's time to hire a caregiver. I can assure you, you'll probably know when it's time, but when depression or loneliness are such that it's becoming unmanageable, if a person starts to miss their medications or have difficulties with their meds, if their home environment, so one of your kapuna's home environment is becoming pretty messy, unkept, if they're driving dangerously, and just a note, we hire a caregiver to gain greater peace of mind. And the 3 biggest issues we have with our kapuna tend to be dehydration, falling, and disorientation. Loneliness is also a huge thing, as I mentioned in number 1. Hygiene concerns, so if they're starting to have difficulty doing their own hygiene, that's also a good indication it's time to get a caregiver. And then of course, if a doctor recommends in-home assistance, that's a good time to get a caregiver as well. Some things you want to watch for is if forgetfulness, like forgetting to turn off the oven, forgetting to lock the door, things like that. So if you're noticing those things, then it's time to start talking about a caregiver option. Okay, so types of in-home care, there are really 4 kinds. So companion care, and I'll talk about each of these in the next slide, personal care, health care, and hospice. Those are 4 different kinds of caregiver services. So we'll get into that a little bit here. In-home caregiver services are not covered by private insurance, Medicaid, or Medicare here in Hawaii. So the only coverage that's out there are a lot of long-term health insurances cover. So long-term insurance covers in-home care, but you want to check with your agent for specifics to make sure it's covered. Sometimes it needs a doctor's approval. Sometimes it's just when you call in. It depends on the insurance you have. Long-term insurance is a separate insurance from your private insurance. So you want to research that a little bit. Caregiver costs to keep in mind. So costs can range from $25 to $38 an hour. I'm not sure during COVID that might have gone up a little bit because of kind of hazardous duty that we're dealing with and some things we have to do. The minimum hour shift, the minimum length of a shift is 4 hours. Caregivers typically in agencies don't like to go out to a shift for anything less than 4 hours. Max shift tends to be 12 hours, and then anything in between. Seniors who want to age at home. So I have to be honest with you, I've never met someone who did not want to age at home. 95% of people would prefer to age at home. Now, occasionally somebody doesn't want to age at home. They may not have any social network or anything, and so they may opt to do some of the other options. But most people want to age in place at home. So seniors who want to age in place at home can require a variety of services, including house cleaning, personal care assistance, meal preparation, money management, and pet care. Those kinds of things, typically, we call that companion care, the assistance with personal care. So personal care needs include bathing, grooming, dressing, toileting, hands-on kind of exercise, so motion, movement kinds of things. And then along with companion care, all that stuff, food preparation, preparing meals, shopping, housekeeping, laundry, and other errands. So personal care is both companion care and personal care. General health care, which is typically what a doctor may ask for, is going to be a nurse. That's going to be someone that's overseeing medications and prescriptions and helping manage appointments and reminders about those things. Now we can do reminders of appointments, of course, personal care and companion care. But general health care, that's a different kind of caregiver. that's going to be a nursing kind of service. So what are your needs? So you want to assess your or your kapuna's home care needs. You want the companion care or personal care. So you're assessing whether they need the companion care, which is hands-off kinds of services, or personal care, which is more hands-on. Mobility, fall risk kind of assistance. So fall risk is probably the biggest thing that brings folks in for caregiving services. Evaluate the help that is needed in the area that of healthcare. So what are the areas of healthcare? You want to be clear when you call for services. What are the needs that your kapuna or you need? Do you need home health care, such as physical therapy or medication management? Again, if you need medication management or physical therapy, that's going to be different than a caregiver. Do you need non-medical personal care, such as help with bathing, dressing, toileting, all the things I mentioned before? Again, because that's going to be personal care, which you pay a little bit more for, by the way. Do you need help with house cleaning, shopping? So you just want to go through the list, write out a list really when you're calling. So you have a list in front of you. So when you're calling and you're saying that you need help with your kapuna and you need a caregiver, then the person on the other end of the phone kind of has an idea what they're looking for. So when they come out, they already have an idea of what kinds of services you're looking for. So what to look for in an agency or a caregiver. You really want to try to hire somebody that's licensed or bonded, a licensed or bonded agency, and the caregiver is then covered through they have the backing. So I have to mention, there's independent folks that are providing services. They're going to charge a lot less, but they're typically not going to be licensed or bonded, so they're not covered. But it is cheaper. And I'll just say, you will get what you pay for generally. Sometimes you get very lucky and do well, but I would definitely recommend the licensed and bonded caregiver. Our agencies need to be licensed in Hawaii to be in business, so you want to make sure that the agency you're talking to is licensed. So hire thoughtfully. You want to hire a caregiver who has the experience in the specific areas in which you need help. People who have Alzheimer's disease, for instance, or are dementia affected, often need help with toileting or bathing, for example. And it's really important that the person understands the Alzheimer's or dementia diagnosis, and they're familiar with working with that kind of person. Agencies, so all caregivers should have a background check. Felons cannot be caregivers in Hawaii, and the agency that's hiring the caregiver needs to do the background check, or the caregiver needs to have a background check done annually. And we're currently also doing fingerprints. So you want to make sure that all that has been done so that you know who you're working with and that they are clear and that they are safe. You kind of want to monitor and set up a schedule to monitor the quality of services that a caregiver provides. So something with the schedule is you want to think about what are the times that you need to have somebody in your home working, or in your kapuna's home working with them. Are mornings kind of the tough time, or lunchtime, dinner time, sometimes overnight? Some people get up and wander, so we do work overnight shifts as well. So you want to just think about what that schedule needs to look like and then monitor that. Make sure it's working to the best that it can. Have a backup plan in case the caregiver or the agency fails to follow through or there are problems that arise. When I was working with in-home care, I always said we'd be 100%, we'd be there no matter what. And then as we started getting kind of busy, that became real hard to do because some things would come up, like somebody's husband had an accident, ended up in the emergency room, and she couldn't make the shift, and we're having a hard time finding people. During COVID-19, it's even harder because you got to make sure that all the protocols are met to make sure the person is safe. So make sure you have a backup plan in case a caregiver doesn't make it. I would say hopefully the caregiver makes it all the time, but you do want to be careful to have a backup plan. Watch for signs of, I'm sorry to say this, but watch for signs of abuse, neglect, exploitation. Report any suspicious activity to the agency that you're working with, and you may have to report it to the state authority if it's not being dealt with. So report those kind of concerns ASAP, okay? Okay, check for, make sure the CNA has completed a CNA course. To do personal care, hands-on kind of work, the CNA needs to have completed a CNA course. So here in the state of Hawaii, all they need to do is complete the course and have documentation of completing that course. Eventually, they'll have to also pass the licensing exam, but for right now, we haven't gone that far with it just yet. But make sure they have that. And again, I mentioned the experience. One thing I found in hiring people is you can't teach compassion. So the person either has the compassion or they don't. And I personally just find the compassion is very important if they're going to work with your kapuna. Reliability, as I mentioned earlier, is very important. I've also found you can't teach that. We try to incentivize that by giving bonuses, and that doesn't seem to improve anything either. So folks generally are reliable. They're not saying things don't come up for folks. Some people have more things come up than others do, though. And your bottom line is you want them to be able to be with your kapuna when they need to be there. Likability is really important too. So it's important that your kapuna likes the person they're working with. And part of that is flexibility, that they individualize the care to the person's preference and needs. I used to be asked, will they clean the way you want, the way I want them to clean, or are they going to do it the way they want to clean? And I'd say, well, show them how you want it. They'll do the best they can. That flexibility is very important. So again, do you and your loved one like the caregiver? It's very important that you like who's working with you. Again, relationships are a very important factor. So what I look for in a relationship is honesty, trust, respect, and professional boundaries. And that's it. So real quick, how do you find someone? So I can't advertise anybody, but people generally will Google or just go on the internet and put what they're looking for, read the reviews, try to pick something that works there. Friends are probably the biggest way folks are referred. There's a lot of senior events that once COVID is over will start happening around the island. You can visit with folks at the table and get a sense of who they are. And then a number of other ways. EOA, so Elderly Affairs, Elderly Office of Affairs is a place to call in the state. They have a list. Our Generations magazine has a resource page that has a lot of folks, and we tend to vet people pretty carefully. So if they're good providers, they'll be in the Generations. So you just go to generations808.com. You can look up there. AARP also has a website, which a lot of information is in there. And those are a few examples. Okay. All right. So I hope that was helpful. Thank you very much.